Hi everyone, Dr.Jyotsna here. I will be talking about nosocomial infection, especially carbapenem resistant gram-negative bacteria, how to diagnose it. As we have limited treatment option, there is a high mortality rate if the patient is infected with carbapenem resistant enterobacteriaceae, pseudomonas or acinetobacter. So ICMR antibiotic uh, antibiotic resistance surveillance has been done, which showed resistance to imipenem was seen in 28% of E. coli, 55% of Klebsiella pneumoniae, and 80% of Acinetobacter baumannii. In carbapenem resistance, resistance occurs mainly by either plasmid mediated or chromosomal mediated. Plasmid mediated are carbapenemase and chromosomal mediators are purine loss, efflux pump alteration, protein binding site alteration. According to the Umbel classification, that is molecular classification of carbapenemase, it is divided into two types, either serine beta lactamase or metallo beta lactamase. Serine beta lactamase is again divided into three types, that is class A, class C, and class D. Class A most common types are KPCs, CTXM. In class C, it is AMPC, and in class D, it is OXA 48, OXA 58, OXA 40. Uh, or in metallobeta lactamase, the most common is NDM, VIM, INP. The treatment option depends upon the mechanism of resistance. So early knowing the mechanism is better for the better prognosis and for less chance of the empiric treatment failure. Rapid diagnostic tests like molecular tests are available. The phenotypes one are gold standard. We can also use genotype one. The carbar is one of the phenotype test of rapid diagnostic molecular test, which tests for five genome, basically KPC, OXA 48, 50, 840, NDM, VIM, IMTs. If suppose we take carbar test, and if it shows that it is these genomes are not present, it doesn't mean that the patient is not having carbapenem resistance gram negative bacteria, because there is chances that the other mechanism which this carbide is not testing, like other genomes or other the chromosomal mediated mechanism of resistance could be present. So at least the most common ones are seen by doing this, the commercially available phenotype test, and if these are present, accordingly we can treat the patient. There are treatment options for that. The treatment I will be discussing it later in the another chapters.